Vidéo pour tous les médecins, étudiants en médecine, urgentologues, les gens qui travaillent dans les unités de soins intensifs. Écoutez cette vidéo en anglais. Un grand prof de médecine aux États-Unis, Dr. Paul G. Harsh, H-A-R-C-H, professeur à la faculté de médecine de Louisiana State University. Non, pas en Corée du Nord, là, aux États-Unis. Regardez bien ce qu'il vous raconte. Ça peut aider énormément la dystonie. Nous, ou le brainstorming en anglais. On a fait ça pendant 2h30 avec les médecins militaires qui ont emmené Arthur dans l'avion ambulance du Montreal Children. Après 2h30 de cette technique, même s'il suggère 1 heure, après 2h30 de cette technique par nos médecins militaires américains, Arthur ne faisait plus de dystonie. Alors qu'on a tenté à Montréal de donner une quantité phénoménale de médicaments. Donc, écoutez ça, les étudiants en médecine, ce que vous n'apprendrez pas au Québec ou au Canada et même en France, dans plusieurs pays. Il faut tenter de niveler le niveau de l'apprentissage de la médecine à des niveaux supérieurs et s'inspirer des recherches. 38 années de recherche à la Louisiana State University. Quand même pas mal. Good day, everyone. Today I have the pleasure and the privilege to be with Dr. Paul G. Harsh, world-famous doctor in hyperbaric medicine, an absolute genius. And I would like him to explain to us how does normobarics medicine or therapy work.
Normobaric oxygen is using one of the two components of hyperbaric oxygen to give a treatment effect. Oxygen, as we are breathing right now, is what's called a respiratory metabolite. It is used to burn the fat, protein, and sugar that is our fuel for our body. When you elevate oxygen for a limited period of time and take it away, it no longer acts strictly as a respiratory metabolite. It now acts like a drug and has drug-like effects on a lot of our genes. And what it does is cause up and down regulation of these genes, with that the elaboration of proteins, and these are involved in the healing process. And that is how this works. And it can work for anyone, even under normal circumstances, but especially in an injury situation. So what it does is it is most active at injured tissue in our body. And that's what we're using it for. And it's been used. It's been shown to be effective and helpful in acute stroke, in acute traumatic brain injury, and we have used it for many years as an extension of therapy for patients we treated with hyperbaric oxygen for wound care, who were unable to continue in the hospital setting but weren't healed. We would send them home with supplemental oxygen to use a couple times a day, and it's effective.
I've seen it work wonders on our son Arthur, who was suffering from severe dystonia or brainstorming. And since the hospital, Ochsner Hospital, and even in the air ambulance, they've all accepted to use your technique. Our son has little or no more dystonia or brainstorming whatsoever. So do you think it should become a standard protocol or standard medicine or approach to cure brainstorming or dystonia?
Yes, I do. It's innocuous. It has no toxicity that can be identified. There's no science showing any toxicity. So it's I'm going to say almost 100% harmless and has great potential upside, as we've now captured on video with a number of patients. You can see it with the little Eden Carlson video, which is online. You can see it with the CBS News piece and the little drowned boy from Morocco, Aden El Jariri. And now we have another mother who has sent me a video of her son who was crushed under a bunch of metal roofing sheets, had a cardiac arrest, and used this to begin resuscitation before they brought him here for hyperbaric oxygen, where he had an even greater effect.
Thank you very, very, very much. It's an absolute honor, privilege to be with you in New Orleans, and for any patients in Canada and the US, if you want to deal with the most advanced medicine, hyperbaric medicine, there's no one better than Paul G. Harsh. So thank you so much.
My pleasure. Thank you.